Hello, I'm Jim Vaughn, co-founder of the RealHealth Companies. Today I'm here with Dr. Thomas J. Lewis, PhD, medical scientist from MIT and Harvard School of Public Health, founder of the RealHealth Companies. Quarterback Your Own Health, a RealHealth company, provides a way for you to take charge of your own health and well-being. Our platform allows you to measure health risks that are personalized to you, perform actions to correct those risks, and then measure how well you are doing on your journey to improve or optimize your health. Dr. Lewis will take us through an understanding of the program we have designed to put you on a path of being the healthiest you can be.
Thank you, Jim. You know, in today's society, we have so much chronic disease. You know, we're seeing prediabetes and diabetes in young people, and we're seeing proliferation of chronic diseases from cardiovascular disease, diabetes, and Alzheimer's in our older generations. And we have a sick care system. So the system waits until an individual is sick and then reacts to the problem, generally by managing symptoms with some sort of drug. But as the Atlantic says, less than 3% of us have a healthy lifestyle. And our disease propagates and proliferates from these risks. So the RealHealth Companies, RealHealth Innovations, is all about identifying those risks and helping people correct those risks, whether they're already in a severe disease state or they're trying to stay healthy and optimize their health well before they have a disease.
So tell me who's behind all this? How did this get developed?
Right, so our main mentors come out of Harvard Medical School. So here's Dr. Clement Tremp, 41 years on staff at Harvard Medical School. He's an ophthalmologist, and that may sound like a strange profession to be providing health solution services, but Dr. Tremp for 30 years has recognized that eye diseases are actually systemic diseases, and the eye is a window to measuring the quality and level of our health and disease. So it's a profound connection, and it's a simple test. The next is Dr. Killen McCulley. Now he's world famous Linus Pauling Award winner from functional medicine and on Harvard staff for umpteen years. He's in his 80s, but what McCulley's specialty is the homocysteine theory of cardiovascular disease and disease mechanisms. And when you can understand mechanisms rather than just what a disease is called, then you have a much better understanding of the fundamental risks behind that, and you can help people make change.
So what are some of the other thought leaders in the industry talking about health and being able to manage your health?
Right, good question. So what we see here is type 2 diabetes is largely preventable. 90% of cases can be prevented. That's the Harvard School of Public Health. 80% of heart disease is preventable. Mayo Clinic. And Johns Hopkins says cancer, help us to prevent cancer, quite a bit is in your control. So what they're not saying is that in most cases, what you can do to prevent is also what you can do to reverse or, say, improve outcomes if you have one or two of these conditions. And what they really mean is, like, let's look at Harvard School of Public Health. Avoid it by taking several simple steps. Those simple steps are reversing small risks that an individual has accrued in their life.
So the quarterback your own health is kind of taking control of that, utilizing technology that is patented by RealHealth Innovations.
Right. What we do is, let me give a simple metaphor for how this whole system works and sort of the underpinning of what the RealHealth program is. So you have a decision to make. In 30 days, I give you $1 million. Or today I give you 1 penny, and tomorrow I give you 2 pennies, and I keep doubling the pennies for 30 days. What would you pick? And most people...
I think I'd take the $1 million.
Take the $1 million. Well, you just took the $1 million cure. But really, at the end of 30 days, with the pennies, you'll have $10.7 million. So let's look at a $10 million disease. You pick the $1 million cure, you're coming up short. What this really means is, each time you remove a risk, you're not just removing one risk, you're getting an amplification effect. So today I removed a risk. I remove a second risk. I remove a third risk and a fourth. And the symbiosis between removing all these risks in the context of your overall health amplifies tremendously. That's what the Real Health program, the underpinning of the Real Health program is all about.
Okay. So can we take a look at it?
Let's take a look at how we implement the program. So the first step is to identify your risks. So we have what we call our living profile. It's simply a survey, it's questions, but it's a dynamic process of identifying a broad array of life risks. It's not about cholesterol, it's not about hypertension, it's about the things that fall under and contribute to those diseases. So we identify your risks, and we provide you with a letter grade. It's very simple, so you know where you stand on the health disease continuum. Very few people in our program get an A, plenty of people get an F. You know, the Atlantic, only 3% have healthy lifestyles. But
so it's called the living profile because it's not something you just take once. It's something that you continuously take over and over again as you work through the different risks in your life, correct?
That's absolutely correct. It's a dynamic process. So we marry that risk evaluation to, and so I would call the risks somewhat subjective. You know, I don't get enough exercise or I eat too much fast food. Those are subjective. The next phase is, are these subjective risks translating into health problems? And to do that, we take what we call your chronic disease temperature. Now, in the real world, in sick care, when you go to your doctor, they do blood labs, and that's what the chronic disease temperature is all about. But they're looking to see if you're sick today. We're looking to see what your potential to be sick in the future is. So our measurements when we do the chronic disease temperature are common biomarkers, but we interpret them in the context of chronic disease. So think about a blood lab and amplifying that signal towards chronic disease.
So even if I feel healthy and well today, if I take the living profile and it says I have a C- on my living profile, my chronic disease temperature might also say that I have a 101 degree temperature.
Right, so how the scale works is we use the chronic disease temperatures based on your core body temperature, 98.6 being perfect health. And then as the temperature goes up, just like the core temperature scale, you're sicker and sicker in terms of chronic disease or have much more risk. So 101 would be a fairly sick individual.
So it's not only telling me as a healthy person that I have the potential of being sicker in the future because of the things I'm doing today, the risks in my life today, but it also will take someone who is unhealthy and on 3 or 4 prescription drugs and identifies action items for them to get back on a path of living healthy, correct?
Right, there's no question about that, Jim. Your blood doesn't lie. The tests we do don't lie. For example, eye test, it's pathology. So the worse your blood score is, regardless of how well you feel, even if you already have a diagnosis, the higher your risk is for that disease to progress and become worse, or if you feel healthy today, for you to have a higher likelihood of being in poor health in the future. And then the last thing we do is, there's a small percentage in the population that when they try to do something proactive, they have a lot of inertia. They don't get there. So for example, the Biggest Losers. They lost the weight, they gained the weight back. There's something else going on in their physiology that we measure with our advanced diagnostics, but that's, say, the 1 to 5% of the population.
So this all sounds really complicated. How does anybody take this living profile and chronic disease temperature and do it easily?
It's actually a very simple process. So what we've developed is an online tool. So here, a smartphone, an iPad, a laptop, your home computer, any place you have internet access, you can access our living profile, and it's a simple survey. Just answer questions, and they're all no free form, just click on answers. And we risk score and rate those answers. And you can see here on a phone, someone took their profile and they got a D. Not a very good grade. But if someone doesn't feel well, you wouldn't expect them to get an A. So this person has a D, and associated with that D, they have an action plan of 13 risks to focus on to improve their health. Now, those are just the subjective. We also took the blood for this individual and showed that they have a very significant chronic disease temperature. The beautiful thing about the chronic disease temperature is that it's a way for us to measure the participant, and the participant to measure us, because once again, we're amplifying the blood story, the blood signal. So if you correct some of these risks and retake your temperature and it hasn't gone down, something's not going right. Either we're doing the wrong thing, we're addressing the wrong risks, the person's not compliant. So it's a beautiful feedback system. We also acquire traditional data like your blood vitals, like blood pressure, and measure your weight and things of that nature.
Okay.
But
So it looks like you just click on the action plans and it just lays out all of your actions for you to do.
right, so for example, click on the action plan. It brings you to another screen, and this person, if we look at their D, here's some of the actions. They need to eat healthier. They need to understand what immune health is all about. They probably have some oral hygiene problems that significantly impacts health. So we have assigned from the living profile a bunch of actions. Some the person has taken the initiative to indicate they're in progress, and if we scroll down, you'd see that some of the actions are already completed. So this person's on their way to better health already.
Excellent. Sounds pretty easy.
Yeah. So what I want to show folks is that you don't even have to take blood labs to draw the blood to understand where you are on the health disease continuum. So what we show here is a plot of your living profile grade. Interesting, we don't go to an A. Very few people get an A. But what we can see as your living profile grade goes down from a B to an F, your chronic disease temperature, and your blood doesn't lie, goes up. And really what the chronic disease temperature is a measure of is your increased risk of early mortality. So when we show this chart to people that we work with in the Quarterback Your Own Health program, and we show that you're a D, who has control over your physiology, your blood labs? You do. You go from a D to a C minus to a C plus to a B, and you've improved your internal physiology. You are getting better. Yeah, you may subjectively feel better, be sleeping better, have less pain, but more importantly, you've reduced your mortality risk long term.
So it sounds to me like I just go online and take my living profile, gives me a grade, it's going to give me my action items, and if my grade's a D, I work through those action items and take the living profile again, like every 60 days or so, and it's going to bring me up to a D plus,
right,
a C minus, and a C.
You're constantly renewing your actions by taking the profile again. And what we recommend, not everybody would be having blood labs drawn. So at the very beginning, we talked about preventable risks. So someone in this regime, just by simply following the action plans and reducing their risk, they're going to get healthier. Some folks, maybe in the F category, would work with our RealHealth team and our doctor to get the blood labs to run the chronic disease temperature.
Excellent.
So let me just go through a summary. As far as we're concerned, quarterbacking your own health, it's as easy as 1, 2, 3. Identify the risks, living profile. Online tool, takes you about 15 to 30 minutes to answer all the questions. You get the action plan. You start working on the action plans to eliminate your risks. Now, in certain populations with bad grades, we might measure your progress with biometrics, but simply taking the profile and eliminating risk will improve your health no matter where you are on the spectrum of health.
So it's just a continuous process. Step 1, step 2, step 3, back to step 1, take the living profile again.
It's a process of continuous improvement.
Excellent.
Yep. So RealHealth Innovations, it's all about helping people identify root cause of risks at the very root of the evolution and genesis of disease, and providing a very simplified action plan to correct their health.
Well, I hope you found this information about quarterbacking your own health valuable to you. Thank you very much.